I'd like to welcome everyone to our Inborn Heirs of the Metabolism Community Chat, Advocacy, and Action. I'd like to thank our collaborators, H2 Network America, the Organic Acidemia Association, and the Propionic Acidemia Foundation, and our sponsor for our summer mini-series, Travere Therapeutics, and then our panelists that we have here today. For those who are in attendance who are not familiar, the inborn heirs of metabolism, or IEMs for short, are rare genetic or inherited disorders resulting from an enzyme defect in the biochemical and metabolic pathways. And this affects how they metabolize or the biochemical reactions that happen between protein, fat, and carbohydrate metabolism. And this presents itself in involving several different human organ systems. Although any given number of the inborn heirs of metabolism are very rare, as a group, they represent about 1 in 2,500 births. And then, although there are many conditions that do affect the inborn heirs of the metabolism, the RUSP, which is the Recommended Uniform Screening Panel that delegates newborn screening throughout the country, there are 35 core conditions and 26 secondary conditions. These, most of all, are these inborn heirs of metabolism. Some states do have less, but some states do have more too. Many of these IEMs result in the need for medical nutrition to help correct the defect in the pathway. And despite the dire consequences for not receiving the necessary medical nutrition, many insurance companies do not cover these life-saving treatments. So today we are going to be having an introduction and status of what is the status of the Newborn Screening Saves Lives Act and the Medical Nutrition Equity Act. And then we'll move into a panel discussion, and then we'll have some simple ways to get involved with these things and at the larger level of advocacy. Advocacy speaks volumes through our actions, and so there are many ways to advocate, and we'll be exploring those today. So our first panelist up today is, actually, he'll be on our panel too, but our first speaker for today is Chris Porter with Travere. And so, Chris, if you want to just tell me when to advance your slides, I'll let you take it away.
Super. Well, thank you for that introduction today, and thank you everybody for giving me the chance to spend time with you on this Saturday afternoon. I hope you are well wherever you are, and thanks also for everybody at the HCU Network America. As Danae said, I'm the head of government affairs and policy for Travere. I've worked on Capitol Hill for a number of years, and then I've been involved in life sciences for about 15 years. But I also am a rare disease patient myself. So actually just last weekend, I celebrated my 15th liver transplant anniversary after I got a rare liver disease about 20 years ago. So myself and my wife and our kids, all the fun that comes with having a rare disease, we've lived through it too. So
congratulations on the anniversary.
Thank you. I really appreciate that, Kelly. So I really just want to, give you a little background on two bills, and then I'm happy to answer any questions and as you all move forward. So why don't you go ahead and go to the next slide, Danae. The two bills that I'm going to talk about, you're probably familiar with, but I'll give you a little depth here. The first is, it's also known as MENA, the Medical Nutrition Equity Act. And the long and short of it is that, as many of you know, is that it would give both private sector and public sector health program coverage, for medically necessary foods. So obviously hugely important to the HCU community and to other communities as well. And as Danae mentioned, she mentioned the RUSP, that it would align for future diseases too, would also be covered as long as they were diseases that were on the recommended screening panel. So this bill's been around since 2009. It has, every time Congress starts, it has to be reintroduced. Every 2-year cycle, they have to reintroduce bills with every new Congress. And so the bill hasn't yet been reintroduced, but the same people who sponsored it in the last Congress are around in this Congress, so that's a good thing. And we expect it to be introduced, reintroduced very soon. You can go to the next slide, Danae. So, as I said, the reintroduction is targeted for next month. So the question is, we all know that something like this is super important. Why hasn't it passed yet? Well, it's super hard to pass anything. It's super hard to pass anything that costs money. And, you know, in previous years, it's just adding benefits to any program is, you know, whenever there's a lot of dollars involved, it just takes a long time. But the good news is that it's very likely that the new Congress is going to do a healthcare bill, like a major healthcare bill that'll coverage on a lot of things. I mean, that will address a number of topics that will affect you. But when they do these giant bills, it's usually the way a bill gets done is to put smaller bills into bigger bills, and that's why people like me have jobs. You know, I think on June 14th, the Coalition, Patients and Providers for Medical Nutrition Equity are going to do a call to action and to try to kick this off. And so the more support we can build before Congress tries to do that bigger healthcare bill later this summer, or it might even slip into the fall, the better position we'll be. So that's it for MENA for now. We can go to the newborn screening bill on the next slide, please, today. So if any of you are familiar with the Newborn Screening Saves Lives Act, it's fairly new. Newborn screening's been around for a while, but it's really only in the last 15 years that they've started to coordinate more programs on this. And so it hasn't been reauthorized in a number of years, the newborn screening programs. It has been introduced in both the House and the Senate by Republicans and Democrats, so it's called bipartisan, bicameral, and it'll do a couple important things, and I try to just show some of the highlights here. Number one is it's going to dramatically increase the amount of money for newborn screening, both for the HHS and the Newborn Screening Advisory Committee, so maybe they'll be able to consider more than one condition at a time. And then it will also dramatically increase money to the CDC, which helps the states do their implementation of newborn screening. So that's a really good thing because, even though once a condition gets on the recommended uniform screening panel, it doesn't necessarily mean that your state is going to do it. They'll do it at their own speed. So having more money and more assistance from the CDC will be able to get that screening take place sooner and faster, and we'll end up saving a lot more lives. There are other provisions to the bill too. They're going to help, it's going to renew the advisory committee. It's going to help do a lot more state pilot projects where conditions can get added on a test basis in the states. So it's a really positive bill. You can go to the next slide. And I mean, there's a million groups that are supporting it. As you can see, there's some of the ones that are listed there. There's been held up, as you may know, in the last Congress by Senator Paul, who was concerned about consent issues. And really, it's kind of a concern about consent, with newborn screening, period. And he's required a lot of education about how hard it is to do research on rare diseases and how that all works. But that remains the holdup, but a number of organizations are trying to work to come to a compromise on that. So like the MENA bill, we're hopeful that we'd be able to get the Newborn Screening Saves Lives Act reauthorization into any upcoming giant healthcare bill that the administration does. So I think that's it for kind of the overview for everybody. Danae, I just wanted to let everybody know that's my email. You're certainly welcome to reach out to me anytime with any questions, and I'll do my best to answer. And if I don't, I'll try to put you in touch with anybody who can help. So thank you all, and I look forward to the rest of the discussion.
All right, thank you, Chris, for that great overview of what each of those bills is and where they currently stand. I'm going to currently pause our share, and then that way focus should now be on the panel here. So what we're going to do here is we have some questions for the panel about how they got involved with advocacy, some barriers, and ways to overcome them, because there's so many things that deter people from becoming involved in advocacy work, because it's time consuming. They're afraid they won't be able to make an impact. And so, the truth is that anyone can make an impact, and everyone has the ability to have their voice heard. And we'll be sharing more ways with how to do that. But what I'd like to do is just have each of the members of our panel introduce themselves. And then if you have questions for the panel as we work our way through, please submit them into the Q&A section, and I will read those off. And so Samantha, we'll start with you. If you could just provide a little bit of background, introduce yourself, and then share about what got you involved in advocacy.
Okay, so actually it's kind of funny. 6 years ago, I think it was around this week, I was actually going through genetic testing to find out what was going on with me. I had a lot of issues going on and couldn't figure out what it was. But fast forward, probably about a year after my diagnosis, I was trying to figure out ways to get more involved. As in today's world, social media plays a big role into a lot of things. And I was just randomly on social media, and I came across a post about Rare on the Road, which is with the RDLA and Every Life Foundation. And I was like, well, are you all coming any closer? I live in Louisville, Kentucky. So I was like, are you all coming any closer to Louisville? And they're like, unfortunately not this year. And so from there on, they put me in touch with Lindsay Cundiff, who's with Every Life Foundation. And she helped me get involved with YAR. And I've been involved with YAR for probably about 3 years now. YAR stands for Young Adult Advocates of RDLA. And RDLA stands for Rare Disease Legislative. And so I've been a part with them for 3 years. And then I've been either involved since then, whether it be going to Rare Disease Week or doing Rare Across America.
Wonderful. Our next participant that I'd like to introduce is Jana.
Hi, thanks, Dana. Yes, my name is Jana Monaco, and I live in Virginia. And I got involved, I guess the start date for my involvement in rare diseases is this May 30th will be 20 years since my son Stephen had a rare metabolic acidosis. So he went into crisis. He was 3.5 years old. He was diagnosed after glaucoma with isovaleric acidemia, which is one of the inborn errors of metabolism. It unfortunately, because of the late diagnosis, it caused a traumatic brain injury. And so he's considered a complex patient with multiple problems, but he survived. And we, got our quick, very fast introduction into rare diseases, inborn errors of metabolism, and that it could have been prevented had his condition been on the screening panel for our state and most states at the time. A year later, we had our daughter. Our little surprise, she too was born with IVA. And, timing is serendipity, because newborn screening and expansion was really coming to the forefront at the time. And we were kind of labeled the poster family for newborn screening and started working on advocacy. When you experience something like this with your child, you want to try to prevent it. And that's what we did. So we got involved on the state and at national level for legislation for newborn screening. And I actually served a term on the Secretary's Advisory Committee for 4 years to help vote for conditions to add to the RUSP. And I am currently on our state genetics advisory committee, and I'm also the Rare Action Network of NORD state ambassador for Virginia. And so it graduated from newborn screening to rare diseases as a whole. And actually, I was excited to say that we actually passed legislation in Virginia last year for medical foods and formula.
Congratulations.
There's a little caveat to it. The way we made it happen after probably 6 failed attempts in my 20 years involved in all of this was to make it for the conditions on our newborn screening panel, because that a treatment is one of the requirements for a condition to be added to the RUSP. And so we held it to that. So my goal is, if we got that, because it is a treatment, then we can work on the other conditions.
That's great. I think you have a good testimony of all the ways to get involved. And, you know, I think this is how so many parents get involved. It starts with their child getting diagnosed with something, because I feel like advocacy kind of chooses us after we're kind of pushed into it.
Absolutely.
And so I'll have Kelly go next.
Hi, I'm Kelly. So I'm the National Homocystinuria representative, as a lot of you guys have seen from my 8 billion posts on the groups. So I work with the Patients and Providers for Medical Nutrition Equity Coalition as their homocystinuria representative. So my job is to go knocking down on Congress's doors, one individual at a time, and advocating for the Medical Nutrition Equity Act. I was diagnosed with HCU when I was about 5 or 6. I have a lot of learning disabilities, a lot of visual issues, plus some other health complications as a result of late diagnosis. I do still struggle a lot with the diet, which is exactly why I decided to get involved. Last year, I lost my job because of COVID, because I was working as a caregiver in a dementia unit, and there was no way they were going to be able to protect me at all. So last October, I heard that the Affordable Care Act was coming up for a vote in, I think it was like the Supreme Court at the time. And it got me really pissed, because this is not the first time I've seen people with disabilities have to jump through hoops and all the stuff that we're already acquainted with that frustrates us probably in small scales every day, sometimes big scales. So it got me mad enough where I finally decided to join back in the ring, as you will, because for about 3 years, I want to say, maybe 2, me and my mother fought for medical food legislation in the state of Michigan. Unfortunately, it passed after the cutoff age that I had already exceeded. So they'll cover it now for until 18, but I was 19 when it passed. It's kind of, it was a bummer, but I was glad that other kids didn't have to go through what I did. So now I do this, and because I was a patient, you know, as a minor and as a young adult who had HCU, I know what a lot of those struggles are. I know what they look like long term from talking to older patients and constituents. And that information has been incredibly invaluable, because then I can pass it along to offices and tell them what happens when these patients go a whole lifetime without being diagnosed, and then suddenly they're slammed into that reality.
Kelly, I'm going to cut you off, and we're going to introduce Brittany, because I want to keep on time with, make sure we have time for everything. There's a lot of ground to cover today. Brittany, you're up.
Thanks, Danae. My name is Brittany, and I live in Colorado. And I'm the mother of 4 kids. 2 of my boys, my only 2 boys, were both born with homocystinuria cobalamin G. And And similar to Jana's story, our first son, Drew, was born, and it is not a newborn screen disorder. And we were living in New York at the time. And my husband and I had some pretty significant concerns about our son early on. We would go to the doctor and say, you know, we have these concerns, and they would just push us aside and say, oh, he's totally fine. Just take him home and love him. And when he was 2 months old, he started suffering severe seizures, which we later found out was a result of, you know, the toxic buildup of homocysteine in his body, which caused significant brain atrophy and brain damage. And unfortunately, because of a late diagnosis, and it actually took us 3.5 weeks in the pediatric ICU to even get a diagnosis and start treatment, he did pass away. So he was 3.5 months old, and that was in 2011, and his birthday was just last week. He would be 10. So it's kind of rough, but our second son, Grayson, he is 2 years old. We knew that he had the disorder before he was born through amniocentesis. We did prenatal testing, and I delivered at a children's hospital, and so he has been getting treatment since the first day of his life, and he is doing amazing. And just a complete show that, you know, you have 2 kids from the same family, and one gets early treatment, is doing fantastic, and the other one wasn't treated and passed away. And so, you know, I do advocate for the newborn screening because it does and can save lives. So I started doing advocacy work within the last 2 years after Grayson was born. And for me, it's really my outlet for all of my energy that I can't, you know, fix my son's disorder. And you know, there's just a lot of those feelings as a parent where you are really nervous and scared, and it kind of is my outlet for all of those feelings and energy. And I work with the Homocystinuria Network and the Cobalamin Steering Committee. I also have the opportunity to advocate through the Mountain States Region Genetics Network, where we work specifically with geneticists in our area. And this year was the first year that I actually did the RDLA Rare Across America, meeting with legislators, and that was pretty fun. And so I'm sure I'll do that again. But it's just been quite a learning experience, and I love it. So.
Thank you, Brittany. I'll quickly introduce myself. For those who don't know me, my name is Danae Barkey. I'm the Executive Director of HCU Network America, as well as a patient. Like Kelly, I was diagnosed late. I was 10 years old when I was diagnosed. And it took years to kind of understand what our diagnosis meant, because we really didn't have proper education through our clinic. And so because of the requirements of the low protein diet and formula, there was some consequences because it took so long to really figure out what we were supposed to be doing. That's a whole nother issue with the clinics. But went off to college, and it became increasingly more difficult to follow the diet, just because of the expenses related with it. And so it really became a choice of, do I pay rent, or do I pay for medical foods and formula and all this other stuff? We do have formula coverage in the state of Illinois, and I'm very thankful for that. However, food is not covered. And so I was not adherent to the low protein diet during those years, and I ended up with a blood clot. And it was the blessing in disguise that I needed, because it really kind of turned me to a group here in Illinois that helped set me on the right path, to figure out what the low protein diet was supposed to look like, that, you know, I was doing before, but it was never correct. And so finally got the guidance I needed. However, it did never really resolve the issue. The only thing it did do is it increased my family's awareness, so they were willing to pitch in more and help cover the expense of the low protein foods. But, you know, the hospitalization made me realize that I'm not the only one in this situation. It took several years, but then co-founded HCU Network America. And so, but really, it's because of being put into that situation of not understanding what I really had, not being able to afford what I needed, that that's why I'm here doing what I'm doing. And no family, I don't care if they have homocystinuria or PKU or MSUD or whatever the situation is, they should never be put into these situations. Part of the RUS whole point of it is, you know, these conditions have treatments. So, you know, what good is newborn screening without a treatment to go with it? And that's why they're partially selected. So our next big thing here is to get them to cover Part B, in my opinion. Newborn screening is Part A, medical nutrition is Part B. So that way we all have the treatments we need. There's many things I've participated in. I'm not going to start running down the list, but I am glad to be able to participate, advocate, and help educate our communities. So we're going to move into our questions for the panel here, just to keep on with the time. And so the one thing I wanted to ask is, when you first got involved with advocacy, what were some of the things that worked well? What were some of the roadblocks that you encountered? Because, you know, not everything's a perfect success, and not everything is an obstacle either. So this is kind of an open question to the committee. So whoever would like to jump on in, feel free.
I guess I'll go first. I started when I was, I guess it would be more, I was more towards 25 years old and very new to the whole rare disease, how do I advocate for myself situation? Because I mean, I guess all through my life I did in a sense advocate, but I didn't have a true diagnosis on what I was fighting for. A major roadblock that I have found is not all senators and representatives and they won't listen. They act like they may listen, but sometimes I feel like it goes in one ear and out the other. And so I think it's one of those things you just got to keep pushing through and hope that one day that will finally get pushed through and they will listen. It's just about being persistent. The more persistent you are, the better the outcome's going to be. Like example for my local representative here in Louisville, I think over the last 2 times that I've met with, or maybe the last 3 times I met with his office and even him, I think they're finally starting to get, the doors are starting to be opened. He may not be co-sponsored on the medical nutrition yet, but he is co-sponsored on the newborn screening. So he's been a huge, so it's Representative Yarmouth, and he's been a huge kind of person in the state of Kentucky to help push it through. And same with Mitch McConnell. We've been talking with him, a lot of the constituents in Kentucky for the rare disease community have been talking to Mitch McConnell, and Mitch is actually trying to help get Rand Paul on board. Being in Kentucky, I know the struggles with trying to get everyone on board, and Mitch has said that he's going to try to help us get Rand on board. So I think the biggest obstacle is trying to push through those doors and staying persistent.
Anyone else more different issues? You know, getting appointments, getting them to listen.
I think oh, go ahead.
Oh,
go ahead, Kelly.
Okay. One of the things that I found that really helps me when I am advocating is paperwork. Leave a paper trail, and it doesn't have to just be, you know, like a physical form, like a piece of paper. It can be online, it can be an email, it can be a message on Instagram or Twitter or Facebook or whatever. I find that having that paperwork is immensely helpful, which sounds super corny to an extent, but there is an underlying truth of it. And I watched my parents advocate for me for like 30 something years now of my life. And my mom is a physical therapist. My dad's a lawyer. So having a paper trail is kind of like the apple does not fall far from the tree type of situation. So the reason why I like paperwork and paper trails is because then I can post them on social media and sort of shame people, like, so we're not having an issue, right? Like you're not gonna just ignore a bunch of vulnerable constituents in the middle of a pandemic, right? We don't have a problem, right? Let's talk. But that generally like shakes them up enough. If I've noticed, like if I post stuff on social media where they start paying attention and they're like, oh, okay, I really shouldn't ignore this person because I'm tagged in this. And my state constituents will see that. So my advice is if you start advocate, like if you're starting to advocate, keep a paper trail, keep it organized, make lists out. The yin yang is like my formula, like lists of people who haven't call me back, people who need to call me back, people who I've had meetings with, people who I'm still trying to get meetings with. Because the biggest issue is that people don't always get back to you, and sometimes it takes a month or more to get in the door to begin with, which is really irritating. I understand I understand the idea of, well, I don't have that kind of time. I've got X, Y, Z, Q, and F all to deal with, which I totally understand.
And it eventually does pay off. Yeah. I mean, there will be stuff that you see, like, I guess it's been since when the last in-person meetings were for Rare Across America. I did see something big at Representative Yarmouth's office. Our representatives and senators do listen. They do try to get things done for us. Representative Yarmouth got a constituent that was with me got her child back on Medicare. So they do listen. And it happened in that meeting. It's just one of those, so I think during that meeting, that's when my eyes opened that they do listen. It may take time, but they do.
I think that's one of the things we need to remember is that these are not the only bills that they're working with. There's so many things that they're trying to juggle. So it does take time. And, if you had a million things dumped on your lap, how are you going to dig through it and start to make sense? And that's where I think, going back to Samantha's original point of, you have to keep having these dialogue and these discussions. One conversation is great, but you need to keep coming back to them and just reminding them these subtle reminders sometimes that, hey, we're still here, we're still waiting, and we really need your support on this is really important. I'm going to go into our next question here, and that is, what do you, if you could go back and give yourself advice, or give you advice to a new parent that's just starting out, what would be your advice? Let's start with Jana, and then we'll move to Brittany, since they both have children.
Looking back, I think, when you think it'll be 20 years, as I said, this May, that Stephen had his crisis. And if you think back 20 years, technology was not what it is today. I mean, I had to have a cheat sheet to turn on the computer, and we had dial up, and so we didn't really have a lot of access to everything that's available to everyone today so easily. But one of the best things that happened for us, and I would encourage anyone, is if you get a diagnosis or you think you have a diagnosis, in what general area, find that support group, find that organization. We watched doctors sitting at the computer trying to find information for us on Stephen's condition because it was so rare. And then they printed out some information on the Organic Academia Association, OAA. And they said, this is an organization for conditions similar for Stephen's and one similar to it. And I was caught up with Stephen, so my husband made contact with the director, Kathy Stagney, and it was one of the best things. It just opened a door, because where we went for X amount of weeks thinking, gosh, what they're showing us that my son is one of 5, all they could show is 5 case studies. But once we had that connection, we were connected with other families who had similar stories, had even sadder stories. They lost their children, but others who were living life with either they themselves or their kids with these conditions. And that was the best thing. And looking back, I wish we could have had it sooner. And so, but as I said, it was technology and we were so focused on our son at the time. So I would encourage anybody to make that contact with an organization that you can relate to, because so much evolves from there. And that's where I got my start with advocacy, because I learned very quickly that this is what was already happening around the country. And so, when you come into it, like most of us do, we know really nothing about it. You don't even know where to begin, but that is really a great launching point for anything. And because most organizations are already involved. And if you have the passion and the desire, that's a great place to start.
I completely agree. I think technology, Facebook specifically, I think back to when I first started trying to connect with people, and it was before Facebook, before MySpace. It was like there was these Yahoo message boards for different rare disease groups. And the first person, ironically, I connected with homocysteine was all the way in Brazil. And I didn't speak Portuguese, she didn't speak English, but we were so desperate for that connection. And I think, it helps make the diagnosis that much easier, just knowing that there's someone else out there going through that same thing. And now with Facebook, being able to ask those families questions, and thankfully it's evolved quite tremendously. It really helps. And even one thing I would recommend to families is, even if you're not ready to technically connect with other families, but join, hang out in the background, just kind of observe. And so that way, when you are ready, you feel comfortable, like the community that you're approaching. I know it can be very scary and intimidating, going in and asking for help.
Absolutely. We originally only had a listserv, and then social media became more popular. But you're right. You could sit there and scroll and read, but you could also engage as well.
I remember my mom talking about listservs when I was like 6 years old. That's how she found Jen in Canada.
Yeah, it's pretty amazing what technology can do for connecting patients. Brittany, would you like to add?
I think just as a parent who has his children who have a rare disorder, it can be very lonely, because even 10 years ago when our son was born, they knew he had homocystinuria with a cobalamin defect, but they didn't know which kind, because cobalamin disorders are labeled with a letter A, B, C, D, E, F, G, J, and X. And we knew he fell within that disease, the disorder spectrum. We didn't know which one though. And he passed away before we could do some of that intense genetic testing. And so we kind of always knew we were part of this family, but never really had that definitive diagnosis for him. And so it was really hard to connect with people because we didn't really know where we fit in the community. And then when Grayson was born and we were able to do that genetic testing and finally got a diagnosis of cobalamin G, it has been incredible for me, just again, to meet with other families who have especially older children with cobalamin G, and to know what kind of future he has, or that he has a future. Because for us, our first son, he passed away, and it was, we didn't know if this was what we should expect for our son Grayson, and the doctors wouldn't tell us, and they didn't, doctors don't want to give us false hope, or I don't know, they just would never tell us any type of time frame or quality of life, or what we could expect for the future, because it's so rare. And meeting with families and talking to them who have the same exact disorder, really just alleviates a lot of those fears. And they've been through a lot. And one family in particular, I've never met them. We've only ever talked over Facebook or text messaging, but I've texted her in the middle of the night about Grayson, terrified that he was doing something. And I was like, oh, she'll never text me back. And it was like 2 minutes later and she responded. And, I think it's just that connection you make with families and other parents and other patients, because it's like you're part of this club you never really asked to be a part of. And you've got to like figure out and navigate how to be in this club you don't want to be part of. And it's nice that other families and their parents are there with you. And it's very helpful. So.
And then,
Danae, could I?
Yeah.
First of all, it's so energizing to be with such a terrific group of advocates, but, don't underestimate your power as an organization, because, and collectively, because, one thing that I was involved or I was around involving a different rare disease group, and that's families who have kids who had short stature disease. This was, I don't know, maybe it was 10, 15 years ago, I can't remember, but I worked for a different company then, but the government in their infinite wisdom had decided that they should make HGH a controlled substance, so treat it like, the heroin. And it was driven by Major League Baseball and the NFL and the Olympic Committee, because they couldn't control their athletes from ordering HGH overseas. So they decided to make a controlled substance, which would really only stop families that needed it and make their life harder to get it, who have kids who needed HGH. And one group, one rare disease group in Chicago, the Magic Foundation, took on all those organizations and killed that bill. And Mary Peters was the head of that. And so, whatever your obstacles are, whether you're fighting something or trying to get something done, a bunch of rare disease families together in one organization can really do almost anything.
I like hearing that. It's encouraging too, because I think, when you look how long the Medical Nutrition Equity Act has, we've been advocating for this and fighting for this. There's some states that, have thankfully so been able to pass it at their state level. But as a national level, there's still the rest of us that are hanging out there holding on hope, and who are still waiting. It's great to hear that, that, voices together can make a difference. And, that's why we need to band together in this, because I think the more of us that are in this together, the more likely we are to succeed. I just want to jump over to Samantha really quick, being that she was a late diagnosed patient, being thrown into this as an adult. I wondered if she had any advice for other patients that were kind of being thrown into the rare disease world as, a teenager, adult, because I know that you received multiple diagnoses in those times. So if you had any advice for patients in that space.
Get involved. I think that was the biggest thing for me. So back when I was, I think I was like 13, 14, somewhere around there, I had a major surgery. I had Chiari malformation, and so I had that fixed. And my doctor since then has connected me with a bunch of patients that he has that are going through the same surgery or even have Chiari and that aren't going through the surgery yet. And so that was my biggest thing, is finding, as everyone said, finding a group you belong with. For me, it didn't necessarily have to be homocystinuria. I also have Lloyd's Dietz. And it didn't have to be Lloyd's Dietz, and that's where YAR came into play for me. Is YAR is a bunch of young adults that have all sorts of different kind of rare diseases. And I think that's what helped me a lot through all this, was seeing such, I don't even know how to describe it, like people my age that are, I would guess say, role models to me. Someone that I'd look up to, even the ones that are younger. Danae, I know you know Taylor Kane, but yeah. Taylor she is like, I think 23 years old, and she is beyond her years in advocating and everything like that. And I always joke, I tell her I aspire to be her one day, and she's like, stop. She's like, always joking, you just stop that. Like, you're doing great as you are right now too. And I think it's just one of those things, you find your niche and get involved in that. And from there, you find those people that inspire you, and it makes you want to advocate more. As I've said many times, I've seen myself at my worst. I'm not going back, and that's why I advocate. I look back at so everything started happening my spring semester of my senior year of college, when you're supposed to be having fun with your friends before you go out into the real world and enjoy life. And for me, I did it for the most part, but there were days where I was just not wanting to do anything. That's how bad it got for me. And I told myself, I've seen myself there. I'm not going back, and I'm going to advocate until I get what needs to be done.
Thank you. I think that was kind of the space I was in too, when after I had my blood clot, I'm like, there's no excuse to go back here. There's no reason to go back from which we came, when for me, it was preventable. And so I put myself there. No, not again. And I was hopefully going to give patients tools so that they didn't have to. So we're going to go on.
Sorry. So I just when Samantha said something, I wanted to put it out there as well, that when I started advocating, I felt like I was very intimidated, right? Because like you said, there was a lot of amazing people out there doing amazing advocacy things. But I started small, and then you build upon it and you get experience. And then I think the greatest thing is, I realized when you enter the advocacy world, no one is in it for competition, right? Like, the more people we can get a part of advocacy, and more people and the more voices, we can get greater things accomplished. And so I didn't have to feel intimidated about being a part of this community anymore, because even if I couldn't give all of this, all of it right now, like, there's always a time when you can do more or do less. And even if you're not at a place in your life where you can, dedicate every moment of your life to doing advocacy, even if it's just an hour every week or whatever you can do, still makes a huge impact. And so I love being a part of the advocacy world, because like I said, it doesn't need to be intimidating. And I think everyone is out to be doing it together. And so they want more people to be a part of it.
I think you just need to start small and then work your way up, because I started off big, and then I'm kind of going into my state too. But do what you're comfortable with. If starting at your hospital is what you're comfortable with, do that, and then work yourself way up.
It also, I think, depends on like the timing in your life. I mean, you have to be in a really good headspace sometimes to be an advocate, because if you're in a place where you don't feel comfortable and confident, it's gonna come out like in the ways that you advocate, and you won't be putting your best self forward.
The one thing I want to say to that, though, is going back to what Samantha said. If you can find people in the community that you can look up to and can help mentor you to help you feel more confident, if it is a hindrance. I had no confidence when I started, but I knew I had to do something. So it was just like, I had to stumble enough to just like, those baby steps. When a baby starts walking, I kind of had to go through those and kind of find out what worked, what didn't work. And then I picked up a lot of mentors and peoples and that I could work with along the way. And that's where, collaboration is so important. And I just, going back to Taylor, I remember seeing her at Global Genes, and she's significantly younger than me. And I was in awe. I was completely in awe of the fact that someone so young, and this was now like 6 years ago, so she was a teenager. It's like, if she can do this, I can do this. Like, it's just, having people to aspire to and help mentor you and lead you along the way. Don't be afraid to branch out to people who are in this space also navigating, and be like, hey, can we have 5 minutes to talk? I really want to get involved, but I don't really know how. And there's people, everyone on this call would be more than glad to talk. I want to transition, though, to the how to get involved, because we have a lot of ways to get involved that I'd like to be able to share. And our panel is each going to take an area. And then we have also our contact information at the end here, too. And if there's still questions from our audience, you're welcome to chime in here. Please do not feel feel like you're not welcome to. You're definitely welcome.
That's the whole reason why we're here, guys. Ask us all the questions.
Yes.
Bring forth the questions.
Yes. All right. I'm going to resume my share here. Sorry, I made my panel screen so big I can't even see what I'm doing. That's not helpful. Here we go. By now I should be used to Zoom, but I'm not there. So Kelly, you're up first. And so we have first up ways to get involved specific to the Medical Nutrition Equity Act. So Kelly, would you mind covering this slide?
Absolutely. So biggest thing that I'm going to say until I'm blue in the face between now and then is the week of action coming up in June. There is training on June 10th. If you can't attend that day, that's fine. It is supposed to be recorded so you can watch it at your discretion and just kind of see what was covered. And then the following week, they're going to have you meet with other advocates from your state to talk to like your state senator, your state representative. The goal is to have 3 meetings. I can't remember what the 3rd meeting is supposed to be, who that's supposed to be with, but I can obviously look into that and touch base with anyone who's curious. But that is going to be the biggest one coming up that's specifically related to the Medical Nutrition Equity Act. Now, I know that the Every Life Foundation and the RDLA are working towards the virtual week on the Hill in July. I would strongly encourage everyone to get involved for that if you can't do the one in June. And I get that it's a big time commitment, but there are slots with the event in June that you can sign up for, so to make it a little more flexible for your schedule. And you know, I remember when I did Rare Cross America back in February, it was a little intimidating, but everybody was so welcoming and so friendly. And they just, they really encouraged me to, get involved. And it was probably one of the better things I think I've done with my time this year, because I've been anxiously waiting for this bill to get reintroduced.
Yeah.
But
so, Kelly, can you talk to them really quick just on like the first things, like we talked about sharing their story and contacting Congress, like as a,
yes.
We'll go into the other things too, the timeline of big advocacy events. So
So the reason why it's super important for everybody to share their story is because this boils down to a numbers game for congressional members. If there isn't enough people to where they think that they should co-sponsor it and vote yes, and help push it through the House and then the Senate to get to Biden's desk, then it's going to take longer. But the more people that they see coming out and they see the greater need for this Medical Nutrition Equity Act, the better, because it pretty much just, it's like a switch gets flipped, where it goes from, oh, it's just 1 or 2 people coming into my office or calling me or, whatever, not that important, to, oh God, there's like 50 people here. I should probably pay attention to that.
Yeah. And I think one of the good things is this, if you're sharing your story, it's written. So you don't have to, if you don't feel comfortable talking to people face to face, that gives you an opportunity to write things out if that's more your platform. But these stories, like Kelly said, are really critical in helping paint the larger picture of, what's not being covered and how it's affected your family. Because there's some families that have had to move, who've had to, we'll go through whatever measures necessary to get what we need for our children. And so I think,
absolutely.
And so there's some stories on there where families are spending $20,000 a year. So you make great sacrifices when you don't get the coverage you need. And then the 5-minute ask, not even, is contact your members of Congress on the slide. And
And if you guys,
literally,
sorry to interrupt there.
oh,
I was
go
just gonna say, if you guys want to make a one pager, which kind of looks like what Danae has on her screen, except it's just about like a bill and what you're asking your representative from Congress to do, but you don't know where to start or how to format it, please reach out to me. I'm more than happy to either send you guys my old one from Rare Across America Week to give you a guideline, or to help create your own, because when it comes from you, it's so unique, and it's so, it's something that you own. You own this thing that you're asking them to do, and there's a lot of power in that. So, I would just highly, highly encourage anyone to make a one pager. They're such a good time saver, if nothing else.
Yeah.
And I get why people might not want to necessarily do it, because they do spend a lot of money on care already, but that's exactly why we need more people to share their stories. We need more people to get involved.
All right, Kelly, just because it is time, I'm going to quickly move on to the next slide. Jana, I have you covering the Every Life Foundation and specific ways to get involved with the Newborn Screening Saves Lives Act. And so I know you've done a lot of advocacy with newborn screening, done a lot of, if you read all of her accolades online, they're tremendous. So if you don't mind covering ways to get involved with newborn screening, and if there's additional things, feel free to add them in.
Yeah, it starts with the same thing, sharing your story. As I said, I was so passionate because it was so devastating that what happened with our Stephen, that it could have been prevented. And then we have our daughter who was screened early through an amnio as well. And so you take it, but I think what I found for myself and what I've learned from others is really starting, and when you think September, it's, Newborn Screening Awareness Month, but learn what your state is doing first. I had no idea. But like you said, there are mentors, and you learn from those that have already been living this life ahead of you. And one of the best things I was able to do was learn what my state program was, because I had no idea. And it was very educational and enlightening to me. And it allowed me to compare what my state was doing versus what was doing nationally and compared to other states. And then, that was really helpful to me to understand what was being screened for, learning that not every state was doing the same thing. So there's a little bit of homework that I think a person should do first, because it empowers you when you are ready to put yourself out there, to go before somebody, to testify, to do whatever. But so share your story, learn what your state's doing, get involved. The Secretary's Advisory Committee, who handles all of this, is open to the public. The meetings are quarterly, and right now they're meeting via Zoom, but anybody from around the country can call in. It's a webinar. You can, and typically it would be a 2-day meeting, but there's always room for public comment. That public comment can be put forth ahead of time. You can register and sign on to do public comment if you want to send something or speak that day. One of the things I've noticed that in all my years being involved in it, and I've been involved with the advisory committees from the beginning, is there was this handful of parents that myself and a few others would attend. For me, it was easy because I live near Washington to and give that public comment. And that's how I got more heavily involved in it. But, it's very difficult to get parents there, but that voice is so important, that the parent voice, the patient voice is important to remind people what this is all about. So it is, as I said, open to the public. You can just go on to Maternal Child Health Bureau, look it up. It's an advisory committee under there, and stay in tune, because that's where you're going. Everything filters down from there as far as what's happening with all of this, with newborn screening and Newborn Screening Saves Lives Act. I mean, that committee functions. I mean, it was given an extension to be able to function without the reauthorization. So the more voices that can be contributed to that, the better. And educating just all around. And when you look at the Newborn Screening Awareness Month, Babies First Test, these organizations, Expecting Health, March of Dimes, they are looking for their stories. They really promote newborn screening during those months. I mean, you can always do it. RDLA, NORD, because people need to know that there are people that are really invested in this, you know, that it isn't just that very small handful of people, because it goes back to each disease, yes, by itself is so very rare, but collectively we're quite a large population representing the rare disease community. And that's what has to be, that message has to be sent home. And in working with people and, you know, being willing to talk and, you know, and just being very well planned out. And one of the things I've also learned is, if you are contacting Congress or the Senate, is don't ever feel bad if you cannot get directly connected to that congressman or woman or senator. The staff people, their jobs are very important, and they will pass that information on. I used to think in the beginning that, oh gosh, that was kind of defeat when I would go up on Capitol Hill and you only got the staffer. But what I learned in educating myself and learning from others is that that person has a significant job to do, and they are held accountable because the people they work for are counting on them to get all of that information to them. So if you can connect with somebody's staff person, that is great. I mean, that is one of the benefits that I've had through all of my advocacy in the different bills that I've been a part of. I've come to know the staff people, you know, first name basis, one-on-one, they know you. And if you can establish a relationship, that just paves the way for a lot of opportunities.
Thank you so much for sharing that, that information. And I think that's really important. You know, if you can establish those relationships, you know, mountains can be moved. I love seeing the pictures after the various events of people and their children with their congressmen, the staffers, because I think it really goes to show, you know, we're all doing this together. And I'm just going to quickly highlight some of, I always have trouble. There are a ton of different awareness events throughout the year. So, you know, and awareness looks a little bit different for each person based upon their comfort level. So, you know, Every Life has a Contact Your Congress. The Medical Nutrition, which is really nutritionequity.org, has a Contact Congress. Those are like 2 5-minute asks. They're really easy to have, pre-populated forms. They make it very easy. So if you don't have a ton of time, those are great places to start. But if you're looking for an event to kind of break the ice, and that kind of will help lead the way for you, these are some other great ones that come. I try to put this chronologically into what's coming up. And so the next big thing is the Rare Artist Contest. Opening submissions start June 1st, and then I believe it's in December that they're announced. And then we have Rare Across America, which actually just happened. And so that's another great event. There's Rare Disease Day. There's so many events around Rare Disease Day, which is the last day of February. And so we get the Ultra Rare Disease Day, which is the 29th when we have a leap year. So great place to look for those events is Rare Disease Day. If you're specific to a rare disease group, they'll typically have events as well. And then there's Rare Disease Week, which is virtual this year, July 14th through the 22nd. It's a great way to advocate on a bunch of different things. And then there's Rare on the Road, which just passed. That was a virtual event, and it targeted 3 different states this year. That was also virtual because of the pandemic. As Kelly had mentioned, one of the big things to push for the Medical Nutrition Equity Act is Speak Up Now for Medical Nutrition, and it's June 14th through 18th. There's actually two different meeting days here. And so one is specific to PKU. The other one is for the larger inborn error, the metabolism community, just because PKU is one of the more prevalent, I think probably the most prevalent inborn errors in metabolism at this point. And so if you go to the website, they will talk you through ways to take action. And then they have training and ways to meet with your representatives. And so great website to check out, Nutrition Equity. They have a lot of flyers, toolkits, information, everything really you would need to know about, and they have ways to contact them too. And someone asked, will the slides be available after this meeting? Yes. So we will be making all this available. And then, so now I have Brittany. So ways to get more involved at the state level or your local level, if you could talk about your experience with Rare Action Network.
Sure. So the Rare Action Network, is through the National Organization for Rare Diseases. And like Danae said, it really targets advocacy on a state level. They do provide, like it says on the slide, the state profiles and state report cards, and that I think can be really helpful for families. It gives kind of an idea of access to healthcare, how your state is doing for newborn screening, and those types of things. I know, like Danae said earlier, some families who have children with a rare disease might look at moving to a new state that might have better healthcare coverage or access to medications. And so those state profiles and report cards can be really helpful for families who might be looking to move or to find a state that can offer them, better support for their child's rare disease or their own personal rare disease. They have lots of educational tools. I have a 15-year-old daughter and a 5-year-old daughter, and I've shown them some of the little videos on the NORD website, just teaching them about rare diseases and teaching them about advocacy too, because as a sibling for a child with, having a sibling with a rare disorder, helping them understand that they can be advocates someday too. The state events, so we didn't have one this year in person because of COVID, but the previous year we went to the state capitol and had a rare disease day at the Colorado State Capitol. And we had the opportunity to sit in on a legislative session. And I have to say, the hardest part for me is learning all this governmental stuff. Like, I'm better talking to people. Like, I don't know all of the ins and outs of government. So it's been a huge learning curve for me, learning about how government works and how laws are passed. And I've learned a lot about that through the Rare Action Network. Nick Kirchhoff is the leader of the Rare Action Network for Colorado, where we have our local Colorado Rare organization, and he is actually a lobbyist at the Hill. So he professionally, and so he knows all the ins and outs and is always happy to sit down and talk with people about how it works and what you need to do to start advocating for those different types of bills or the legislative action. Let's see, it's wonderful. The other thing I was going to say about NORD is they do have disease specific grants and support for families. And so you can go onto the NORD website, and if you are, know someone who's struggling financially or are yourself with different aspects of your rare disease, they do offer grants specific to different disorders. I know right now they just launched a grant where you can go and get a medical alert tag for yourself or your child, and they pay for that yearly subscription for you. So they provide a ton of different resources besides just the advocacy part. They really do support and connect different families together who have similar disorders. So yeah.
And if you're interested in getting involved with RAN, the rareaction.org website, it's very easy to navigate. NORD is a great website too. And like Brittany said, there's so many tools and programs that are available. I definitely encourage people to take a look around.
And one more thing, I know that they've been trying to push, they call them RDAC, so it's a Rare Disease Advocacy Council in each state. And what that does is allows direct contact with your state legislatures on the Hill. And right now, Colorado's in the process of enacting an RDAC. And I know that there are several states that do have them. So depending on where you live, you can look and see if you have a rare disease advisory council, and you can get involved, because I know they're always looking for more people to be a part of that.
Absolutely. Michigan's actually just had a hearing in Lansing about that. I actually gave my testimony.
It's great.
I think it's a great way because, you know, sometimes if you're feeling a little bit lost, it's nice to have that local support too. So you can have your disease group specific support, you can have the national groups, and then it's nice to have the local too if there's something specific that, you know, your state needs to specifically address. So there's so many different ways here. We're going to quickly advance here to things that are the larger, more broad, and so ways to get involved at the federal level. I have Samantha, if you could quickly cover here RDLA and YAR, since you have got to experience that. So
yeah, so YAR is for ages 16 to 30. They're still trying to figure out how to transition you out, because YAR is actually pretty, I mean, it may not seem new, but it's on the newer side. I think it came about maybe I think it was only 3 years old when I first, or maybe a year old when I first started. And so the age range has expanded since then, because it was to, I think, 25. And I remember I was almost 25 and I emailed them saying like, hey, I know I'm almost at the cutoff, like, but they're like, no, we're about to extend it. So everything is still evolving with them. But they're the biggest, for me, they're the biggest group that I've been involved with that I feel included, I guess is be the word. Not that I don't feel included with any other group, but I think when you connect with people more your age or around your age that have struggled with a rare disease and how to connect, it's easier to get involved. And so with YAR, with my first experience trying to, like, with Rare Disease Week, I wasn't gonna go because I was just like, my mom has always been there with me. My mom was actually pushing me to go by myself. And I told her, not gonna happen. Just cause like, I am very much I don't wanna say shy, cause I'm not shy, but I'm more of like, I don't come out of my shell very easily. And only until I was diagnosed, I was maybe about a year after I was diagnosed, I was not comfortable sharing with anybody. And my first Rare Disease Week is when I came out of my shell and learned so much. They teach you a lot too. So that's why the Rare Disease Week is so long. They teach you things that you would have never thought they were going to teach you. Like, they teach you how to get your pitch down to 1 to 2 minutes. Because when I was first heard, like, I was having to get my pitch down to 1 to 2 minutes, I was like, yeah, that's not going to happen. Just because, like, because you think like your pitch expands your whole life. But getting it down to the 1 to 2 minutes is very important, because if you go over, you're not going to have everyone listen. But YAR and RDLA have been a big support to me. And even when I have questions, I email someone or I talk to someone within the YAR Facebook group, and they're always so supportive. They always say, like, there's no dumb questions. Like, you know, you always hear there's no dumb questions. There's really not. And I think that was my biggest thing, was how do I get involved? And that was reaching out with YAR was my biggest thing.
And I think the one great thing is that YAR just implemented, I think this was the first year, and you can correct me if I'm wrong, but they have an academy now.
Academy.
Yeah, and so
they're actually still trying. I haven't heard if they're going to redo it yet. Okay. This was a trial, I don't want to say trial run. I think they're in talks of wanting to do it again. I think they were just waiting to see how this ran first in order to, and I think that they're probably going to, and I can't speak for them because I don't know the specifics, but this was going to be the trial. And I think they had a lot of people apply. And I mean, I hope that they extended, because I really wanted to do it this time around, but I just had so much on my plate that it was just not comprehensive with my schedule, because so they had classes on Wednesday nights. I think it was like once a month, and they were for like 4 hours. And Danae knows my busy schedule. That was just not, my busy schedule could not accommodate with that. But the Yard Leadership Network or Academy was to help you get, I don't want to say get a job within a company, I guess you would say, like a patient advocacy company, but to help you prepare for other things.
That's the thing I think is great about YARS. You know, I think about Brittany's her children who have grown up with this, and, you know, Jana's daughter who has also grown up with this. It gives young adults a way to get involved, and because, you know, it's hard to kind of navigate that.
Right. You don't have to have a rare disease to be involved. There is actually a girl, she's actually, I think, 23, 24. And she just had a baby. I think she's now like 7-ish months. And her daughter's got PKU, and she's not the one that's infected, but she's in YARD because she wants to be a better advocate for her daughter.
Yeah, and I think that it's really important is that we give, you know, young adults these tools too, because it's a world we all have to navigate. And it's great that they all can have a voice.
NORD is doing, they have the Living Rare Forum in June, and my daughter is actually one of the panelists for the siblings. It's interesting because Steven's there. I'm there with Steven since they are together. But so she talks about being the sibling, even though she shares the same disease, of being Steven's sibling, and, you know, a little more what's involved and what it's been like to, you know, grow up with him, because she's only known him after crisis, not like my older sons. But it's a panel with a few other siblings, and the two, they are not affected with the rare disease. So it's going to be a great panel because it's interesting to hear them and their experiences of something totally different. And that's next month.
And I think it is important for the siblings to get involved. I have a younger brother.
Absolutely.
He's seen, the siblings have seen everything that their sibling that is affected go through. I mean, my brother has, since he is younger, he's seen everything from before diagnosis to after. And I think it also helps the siblings be, I don't want to say a better person, but better understand certain things that go on in the world.
I agree with that. You know, I mean, when I think back to like how I grew up, my one brother is 2 years older than me, and the other one's 5 years older than me. So I'm the only girl, youngest, and I have this. So all that, you know, protective older brother stuff gets amplified like crazy, of course. And my mom really has to like curb some of their behaviors because I would try to, and you know, my mom had to tell him, be like, you can't be the food police, because every time you do, you're just wrecking your relationship with that person. And I'm so glad that like she did that, because she was like absolutely correct when she said that. But it's only now as like an adult that I'm actually understanding like how forward thinking that one little thing was. So, you know, having a place to get siblings involved, I think also gives them, you know, an opportunity, just like our support groups do with us, but it gives them a place where they feel supported and they get to talk to other siblings who are going through the same thing.
I think this, I don't know why this just popped in my head, but YAR is working on a mentor program. So when you do transition out of the age range, you can still somewhat be involved.
we're going to wrap this up here just because we're over our time. I really appreciate everyone's sharing today. You know, I know it's hard sometimes to share some of these things just because when you start to unpack, it's it can be emotional.
We could talk about this all day long, I have a feeling.
I always have to like stop myself at some of these events and I'm like, okay, hold it in here, because just listening to people too gets me gets the passion worked up, but also the emotions. And so if you have questions or if you would like to connect, I have the information here for our collaborating organizations for HTU Network America. The OA, their executive director is Kathy Stagney. She has her email there that she was glad to share. And then the Propionic Acidemia Foundation has their email. They are very glad to connect with families. The OA covers a huge group of metabolic disorders that are affected by the organic acidemia. So Kathy is very knowledgeable and able to cover those. And then HTU Network America covers all the homocystinureas, and PAF also covers all the propionics. So we all kind of overlap each other in some aspect. And then all our panelists today here have also agreed to stay in contact. Their email addresses are here. Kelly has her Instagram handle to stay in contact, just because.
I'm sharing my email address in the chat for anybody who would like to get in contact.
Yes. So if you have any questions, please feel free to reach out. I appreciate everyone hanging in for the additional 20 minutes that we went over, but I appreciate our panelists. I hope that everyone here today has found a way that they can participate. You know, actions are what lead us to change in our communities. And so, you know, if it's a 5-minute fill out the form, or if it's getting involved in your state or sharing your story, there's so many ways to make change and help advocate for these things. So we hope that you have learned something today and can take away, or if it's just about, you know, connecting with someone here that participated in the panel to help mentor you through the process. We hope that you have been able to accomplish that. So thank you again, everyone, for your time. I'd like to again thank Travere for their sponsorship of our mini summer program, and then the Organic Acidemia Association and the Propionic Acidemia Foundation for their collaboration in this event. We need to stop the share. Thank you so much, everyone.
Thanks, guys.